Hello, and welcome. Today, we're diving into a critical heart condition called cardiac tamponade. It's a life-threatening situation where fluid builds up around the heart, squeezing it and preventing it from functioning properly. Understanding this condition is crucial, so let's get started. So, what causes this dangerous fluid buildup? Cardiac tamponade can arise from a number of different triggers. Common culprits include penetrating injuries to the chest, like a stab wound, blunt trauma from a car accident, or even complications following heart surgery. Certain cancers, such as lung or breast cancer, can also lead to tamponade. Other potential causes include pericarditis, an inflammation of the sac surrounding the heart, kidney failure, or autoimmune diseases like lupus. Essentially, anything that damages the pericardium or leads to fluid accumulation within it can potentially trigger cardiac tamponade. Now, let's explore the pathophysiology or how cardiac tamponade actually impairs heart function. The heart is enclosed in a sac called the pericardium. When fluid gradually accumulates within the sac, it initially stretches without significantly impacting heart function. However, once the pericardial sac reaches its maximum capacity, the increasing pressure starts to compress the heart chambers. This compression impedes the heart's ability to fill with blood during diastole, the relaxation phase. As a result, less blood is pumped out during systole, the contraction phase, leading to a decreased cardiac output. This reduced cardiac output starves the body's organs of oxygen, leading to shock and potentially death if left untreated. Cardiac tamponade isn't something that affects a huge portion of the population, but it is a serious condition. It's difficult to give exact numbers, as it often arises secondary to other conditions. However, it is more frequently seen in individuals who have experienced chest trauma, undergone cardiac procedures, or have certain pre-existing conditions like pericarditis or cancer. The incidence also varies geographically, depending on the prevalence of these underlying conditions. The signs and symptoms of cardiac tamponade can develop rapidly or gradually, depending on how quickly the fluid accumulates. Some common warning signs to be mindful of include shortness of breath, especially when lying down, chest pain, which may feel sharp or dull, lightheadedness or dizziness, and palpitations or a rapid heartbeat. You might also notice swelling in the abdomen or legs. A classic sign, known as Beck's triad, involves low blood pressure, muffled heart sounds heard through a stethoscope, and distended neck veins. If you experience any combination of these symptoms, especially after a chest injury or if you have a known risk factor, it's vital to seek immediate medical attention. Diagnosing cardiac tamponade involves a combination of physical examination and diagnostic testing. A physical exam might reveal the signs of Beck's triad we just discussed. An echocardiogram, an ultrasound of the heart, is a crucial diagnostic tool that allows doctors to visualize the fluid around the heart and assess the degree of compression. Other tests that may be used include an electrocardiogram, or ECG, to check for electrical abnormalities, a chest X-ray to look for an enlarged heart silhouette, and blood tests to rule out other possible causes. While the severity of cardiac tamponade can vary, there aren't distinct types or classifications in the same way as some other heart conditions. It's more a matter of how quickly it develops, which influences the severity, and how quickly it needs to be treated. It can be acute, meaning it develops rapidly, or subacute, which progresses over days or weeks. Treatment for cardiac tamponade is focused on relieving the pressure on the heart and restoring normal heart function. The primary treatment is pericardiocentesis, a procedure where a needle is inserted into the pericardial sac to drain the excess fluid. This is typically done under ultrasound guidance to ensure accuracy and avoid damaging the heart. In some cases, a surgical procedure called a pericardial window may be necessary. This involves creating a small opening in the pericardium to allow continuous drainage of fluid into the chest cavity. Depending on the underlying cause, further treatment may be needed to address the root problem, such as treating an infection or managing cancer. Supportive care, including oxygen therapy and medications to stabilize blood pressure, are also essential. Preventing cardiac tamponade focuses on addressing the underlying conditions that can lead to it. This might include preventing chest trauma by following safety precautions, promptly treating pericarditis with appropriate medications, and managing cancer effectively. Regular check-ups, especially for individuals with risk factors like kidney failure or autoimmune diseases, can help detect problems early before they progress to cardiac tamponade. The prognosis for cardiac tamponade depends on several factors, including the underlying cause, the speed of diagnosis, and the promptness of treatment. With rapid diagnosis and treatment, many patients make a full recovery. However, delayed diagnosis or inadequate treatment can lead to severe complications, including shock, organ failure, and death. Research continues to explore new ways to diagnose and manage cardiac tamponade, focusing on improving the speed and accuracy of diagnosis, refining treatment techniques, and developing new therapies to address the underlying causes.